This is truly the poetry of presentation formats. Good ideas distilled to their essence. So sit back, focus your minds, and enjoy the ride. Our first presenter is Brenda Andreas. Brenda was born and raised on the prairie in the southwest corner of the province. She is a patient family advisor with the Cypress Health Region and the primary caregiver to 4 generations of her family. Her job is priceless. Take it away.
Here on the prairie, morning coffee row is pretty much a given, and generally there are 3 topics of conversation: the weather, the potholes, and healthcare. The weather we live with, the potholes we avoid, and we are passionate about our healthcare. In a small rural community, healthcare is personal, very personal. Often our healthcare providers are family and friends. For the first 55 years of my life, my mother was the face of healthcare in our community. She started her nursing career in 1951, and she finished 47 years later as the matron/director of care of the Maple Creek Hospital. She shared her life with her work and raising her family. When I was 15 years old, Mom said to me, "Bunna Jean, I have a little job for you." So after school, I walked over to the hospital, and she took me down A wing to a room where a pale and frightened little boy lay in traction. He'd fallen off his horse and broken his leg. He and his family were devastated. They had never been apart. But home was 2 hours away, and they were unable to visit. I visited with that little boy every day for 6 weeks. This is but one example of the compassion and dedication that my mother brought to her nursing career. It was quite a shock when the cancer came calling, and we as a family did not get the care and the support that we needed. As Mom went through her first bout of cancer, she watched as Dad died from his. Our hospital was temporarily closed, and Dad was sent to a hospital 60 miles away. Mom was too ill to travel that distance, and after almost 60 years of marriage, she did not get to say goodbye. Short months later, Mom's cancer returned, and she was admitted to the Maple Creek Hospital. I had to fight to get her pain control and access to diagnostic imaging. Like Dad, she was denied the privilege of being allowed to die in her own hospital, surrounded by family and friends in the community where she'd spent her entire life. Grief and anger are hard pills to swallow. At all costs, I would have loved to avoid the local healthcare system, but I could not. I have a twin brother, Brian Albert. He was diagnosed with AIDS in 1984. In 1997, he was told to put his affairs in order and say goodbye to his family. I called the family together, and I asked Brian to come and live with me. In 2005, we moved back home to Maple Creek. Brian wants to die at home, and it's my job to make sure that it happens. I call it his journey to the rainbow. I had no choice. I had to get up close and personal with the local healthcare system. I decided to become a patient family advisor. It all started with a near religious experience. I got to attend last year's Health Quality Revival Summit meeting in Regina. I watched and I learned as the quiet, timid voice of the patient and family were encouraged and supported to be heard. For the first time in a very long while, I began to feel hope. Maybe, just maybe, my healthcare system could help me to help Brian. To the question, what do I think is possible for healthcare in Saskatchewan based on what I have seen and what I have experienced? Over the past 3 years, I have been given a number of opportunities to participate as a patient family advisor in Maple Creek, in the Cypress Health Region, and around the province. These opportunities have changed me. Let me tell you another story. Recently, I went with Brian to see his doctor. He's been having really bad headaches. He wasn't eating, he wasn't sleeping, and he wasn't walking the dog. It was serious. His doctor wanted to send him off to Saskatoon for a consult, but I said no. Brian doesn't travel well. The logistics of his not eating all day, of trying to find bathrooms along the way, of dealing with his anxiety and his cognitive impairment, there had to be a better way. The outcome was a win-win. Brian did not have to travel far to have his health care needs met. If I had not become a patient family advisor, I would not have had the courage to speak up to be a partner in deciding how to best meet my family members' healthcare needs, to see firsthand the commitment by the Cypress Health Region to make sure my healthcare experience is better, to partner with me and my community to do this. I personally have had the opportunity to be a part of 2 RPIWs. I've seen the calls out to the community asking for input and engagement. I have seen the response from interested community members. And as patients and family have participated, I have seen a genuineness and a willingness on the part of the Cypress Health Region at all levels to be open and welcoming. After all, we both want the same thing. We want our healthcare experience to go well. We want the focus to be on us and our loved ones. We don't want to have to worry about undue harm or about our voice not being heard. And I see this every time when Brian engages with his healthcare team. Little things like when he goes to the lab and he gets called in immediately because he has no immune system and they know who he is and what his health needs are. Or when he goes to see Dr. Joe, and the first part of the visit is always about Brian the person and not one of the longest surviving AIDS patients in the province. When I started on this journey of becoming a patient family advisor, I did not have confidence or trust. I did not believe that the delivery of health care could change in my community. My experiences have shown me otherwise. I now have the faith that when I need help, my team will be there to help me. The experiences I have had as a patient family advisor, there's my emotions again, have given me a greater insight into the delivery of healthcare in my community and the front row seat that I have in determining how my healthcare needs are met. We as patients and family need to continue to be strong advocates for ourselves and our family. We need to move beyond being observers of our own healthcare experience to being participants. This needs to come as easily for us as does the casual conversation on Coffee Row. Thank you.